Today, I'm going to give a brief review of IgA nephropathy, as a viewer requested. I've talked about it before, but since it was only in parts, today I'll discuss it more systematically. First, let's define IgA nephropathy. It is a disease where IgA antibodies accumulate in the glomeruli and cause chronic kidney disease. It is one of the most common glomerular diseases worldwide, especially in Asians and Caucasians, while it's rarer in people of African descent. The disease typically occurs in the late teens to early 20s and is more common in men, although it also affects women. Now, for those who are hearing about this for the first time, you might wonder what IgA is. IgA stands for immunoglobulin A, and this disease occurs due to problems with immunoglobulin A. To explain that, let's first discuss immunoglobulins. Immunoglobulins are types of immune cells. There are 5 main types: IgG, IgM, IgA, IgA, and IgD. These immunoglobulins are crucial components of our immune system. IgG is involved in long-term immunity after infections or vaccinations. It provides immunity, meaning if you encounter the same illness again, your body can respond quickly because of the immune memory. IgM is the first antibody produced during an initial infection. It exists as a pentamer in the circulatory system and forms antigen-antibody complexes to effectively fight off infections. IgA is the focus today. It plays an important role in protecting mucosal surfaces like the respiratory tract and gastrointestinal tract. It is found in secretions such as saliva, tears, and breast milk, and helps block pathogens from entering the body. IgA is involved in allergic reactions and defense against parasitic infections. When allergens trigger an immune response, IgA causes the release of histamines from mast cells and eosinophils. IgD is involved in activating and regulating immune B cells, but its exact role is still not fully understood. These 5 types of immunoglobulins act like different branches of the military. Each one plays a specific role in protecting the body. Just like how the military branches have different roles, each of the immune system components has its own function in protecting the body. Today, we're discussing IgA, which plays a role in protecting the respiratory and gastrointestinal tracts. When viruses or bacteria invade, IgA is the first immune molecule encountered in the mucosal surfaces. IgA nephropathy is a condition where there is an abnormal production of IgA1, which lacks galactose. This abnormal IgA1 becomes modified into an antibody that attacks the kidneys. Essentially, the immune system mistakenly attacks the kidneys, thinking that the glomeruli, filtering units of the kidneys, are foreign invaders. As a result, immune complexes deposit in the glomeruli, causing inflammation and damage. This leads to problems with the complement system and repeated inflammation, creating scars in the kidneys. Over time, this damage reduces kidney function. IgA nephropathy is considered an autoimmune disease because the immune system is incorrectly attacking the kidneys. It usually begins in younger individuals. However, many cases are discovered later. The main symptom of IgA nephropathy is recurrent hematuria, blood in urine. This often occurs about 2 weeks after an upper respiratory infection or gastrointestinal infection, such as gastroenteritis. Some patients may also show mild proteinuria, and in severe cases, significant proteinuria occurs. When the kidneys are attacked by the immune system, hypertension can develop, and kidney function can decline. In many cases, especially in younger individuals, there may be no symptoms initially. It is often detected during routine checkups, where traces of blood are found in the urine. The diagnosis of IgA nephropathy is typically made after a history of hematuria following an infection, and the presence of persistent proteinuria or hypertension. Blood tests may show elevated creatinine levels, indicating reduced kidney function. When IgA nephropathy is suspected, a kidney biopsy is required for a definitive diagnosis. Without a biopsy, it's difficult to confirm IgA nephropathy. If there is hematuria but normal creatinine levels and no proteinuria, it's possible that the condition is mild and may only be suspected. However, a biopsy is essential to confirm the diagnosis of IgA nephropathy. Many patients suspected of having IgA nephropathy do not undergo a biopsy. In cases where the hematuria is not severe, the treatment often consists of supportive care. If the patient has high blood pressure, ACE inhibitors or ARBs, angiotensin receptor blockers, are used to control it. These medications help reduce proteinuria and protect the kidneys, making them essential for IgA nephropathy treatment, as they play a significant role compared to other antihypertensive medications. It's also important to follow a low-salt diet and limit protein intake. I often advise patients with proteinuria to reduce their protein consumption. The extent to which protein should be restricted remains a subject of debate, but limiting protein intake in IgA nephropathy is particularly crucial. This is because protein itself can act as an antigen, stimulating IgA production and exacerbating the condition. If IgA nephropathy is suspected and kidney damage progresses, with creatinine levels rising or significant proteinuria, a biopsy should be done to confirm the diagnosis. Once the damage is severe, more potent medications, such as immunosuppressants, are necessary. The first step in treatment is often corticosteroids to address proteinuria of 1g or more and declining kidney function. In more severe cases, stronger immunosuppressive drugs, such as cyclophosphamide or mycophenolate mofetil, are used. These treatments require careful monitoring due to their effects on the immune system. Patients should also focus on managing their lifestyle and risk factors. If a patient smokes, it is crucial to quit, as smoking can further damage the kidneys, especially in individuals already experiencing renal dysfunction. Maintaining a healthy weight by avoiding obesity is also important, as it helps reduce strain on the kidneys. In cases of chronic kidney failure resulting from IgA nephropathy, managing the additional complications associated with chronic kidney disease is necessary. As mentioned earlier, a low-salt diet and protein restriction are key aspects of care. In terms of protein, plant-based proteins are preferred in these cases because animal-based proteins tend to stimulate immune globulin production, exacerbating the condition. When consuming protein, it's recommended to focus on plant-based proteins, such as tofu or beans. Now, patients diagnosed with IgA nephropathy often worry about their future health. The prognosis can vary. Some individuals who were diagnosed in high school with hematuria and received a biopsy may live without further issues and no hematuria for the rest of their lives. However, others may experience progressive kidney damage, leading to chronic kidney disease, while some may unfortunately require dialysis in their 30s or 40s. To predict how much kidney damage might occur, risk factors like uncontrolled high blood pressure or significant proteinuria are key indicators. These factors can increase the likelihood of kidney failure and the need for dialysis in the future. Therefore, controlling proteinuria and high blood pressure is extremely important. Studies show that about 20% to 40% of individuals diagnosed with IgA nephropathy will require dialysis within 20 years. Even after undergoing a kidney transplant, there is a 20% to 30% chance of IgA nephropathy recurrence due to the use of immunosuppressive drugs, although the prognosis remains relatively good. IgA nephropathy is the most common glomerular disease worldwide, with a particularly high prevalence in South Korea and Japan. Consequently, much research has been conducted in these countries. When I was in elementary school, we used to perform stool tests for parasitic infections, but nowadays, schools include urine tests in health checkups. Urine tests can detect conditions like diabetes, proteinuria, or hematuria, enabling early detection of IgA nephropathy, which is critical for managing the disease and preventing progression through supportive treatment. Once IgA nephropathy develops, it cannot be completely cured because the immune system remains improperly activated. Thus, long-term management is required. Recently, there have been significant advancements in treatments for IgA nephropathy, including targeted immunosuppressive therapies, monoclonal antibodies, and potentially gene therapy. These innovations give hope for more effective treatments in the future. Even for patients with IgA nephropathy, routine monitoring with a nephrologist is essential. Managing high blood pressure, maintaining a healthy lifestyle, and seeking timely treatment if kidney function declines are crucial for keeping the condition under control. For example, one of my patients, diagnosed with severe IgA nephropathy over 10 years ago with a creatinine level above 3, was initially advised to begin dialysis within 6 months. However, after undergoing a biopsy and treatment, the patient has maintained creatinine levels between 1.9 and 2.1, living healthily well into their 70s. This case highlights that with proper treatment and lifestyle management, even elderly patients can live well with IgA nephropathy. Therefore, don't lose hope, but make sure to seek appropriate treatment to avoid progression to kidney failure. Thank you for listening.